here is, you see, case taking in children, and let's see a little bit about this. It's a very important subject, and because a lot of our patients are children, huge percentage, I would say. And they are the best people to treat because, you know, they are obvious, you can observe them, they don't tell too many lies, they don't cover up too much, and they have the best chance of recovery and a long term, you know, we can help them for a long term, really. So what are the important factors to consider in every case? The details of the child's complaint, present and past. So the, you know, all the, whether he has a cough, he's got loose motions, abdominal pain, what are the details? What is the location? What is the modality? Maybe it's a skin problem. Maybe it is a behavioral problem. What are the details? Present and past, because sometimes, you know, the past symptoms can also be very characteristic, you see. So he had a fever like 1 year ago, and during the fever, he had a profuse perspiration only on the chest, something like that. So the peculiarity not only of the present, but also of the past. Then comes the generals. That means, you know, the appetite, thirst, urine, stool, sleep, position in sleep, perspiration, where it is, where not, all the generals of the child, whether he's hot, chilly, he covers, doesn't cover, he has drinks water, not, etc., etc. Then your observation, when you see the child, what do you observe? How does he sit? How does he stand, walk? How does he relate to you? How does he relate to the parents or to the attendants? What does he do? Is he restless? Is he what exactly, you see? And then the observation by the attendant, by the parent, you see. And what is the meaning of this observation? It means that we don't want the opinion of the parent. You see, we don't want the parent to say, this is a jealous child, or this child has inferiority complex, or nothing like that. Just what do you observe? You know, what do you see? That is what we want to, what we want to know. How does the child behave? What does he do? What is he sensitive to, etc. In verbal children, talking to them has to be at the level of delusion. Most children who are verbal, they talk in images, imagination, Superman, Batman, horror movies, you know, cars, you know, all of these things, you know, their imagination is very, very active. So you start to talk at that level. Oh, tell me about Superman. What does he do? How does he do? Go into the world of fantasy. And there you will see, you see what is the exact sensation, kingdom, rubric, mental symptom, etc., etc. You will see it right there. And then the mother's history during pregnancy. So these are the various, you know, aspects of a child's case, and all these should be eventually pointing to the same remedy. When all of this points to one remedy, you have the remedy. That's what the idea is.